Arthur, the doctor will see you now.
Yeah, Arthur, how are you?
Been better.
Go ahead and take a seat. So tell me, how are things going?
Not great.
Not great? Yeah? You got any new concerns going on, or are things, kind of the same as they were?
Same as they were. Kind of just wondering why I can't do the normal thing. So.
All right. So are you feeling worried about ending up having more problems, or is it you're kind of just okay with things as they are?
It's a stent that got put in. I thought I would be able to just go back to living the same life, and I've just noticed I'm a little afraid of things, but not very keen on changing. I'm pretty old, so I don't want to kind of set my ways,
Mm-hmm. All right. We all have our own opinions and different things, and I'm hoping that I can help you get give you a little more information so that we can work towards helping you reduce the risks involved with CAD and be able to help you get back to work like you're hoping to. So I've got a pamphlet here for CAD to give you an idea, more information about it. I've got mostly 4 risks that I'm more worried about with it.
Oh, okay.
Yeah.
Thought it was getting to me, Couldn't read there for a second.
All right. That would be concerning.
Yeah.
I'm glad you're able to read it though.
Yeah.
So,
when can I meet this Thai guy?
it might be a day in the future, or maybe I'll call him in later.
Okay.
So starting off, I have where, looking at CAD, you had the stent because you had the chest pain, you had the shortness of breath and fatigue. And so you had the stent, and have you felt like those have really cleared up, or is it?
I haven't really tested myself to get to that level. Kind of afraid that it's just going to be the same.
Okay.
I don't really feel like the stent really helped that much, and I'm not really willing to kind of exert myself to that degree because of, I'm afraid for my wife and my 2 kids. I'm the sole provider, so I don't want them to be kind of left without me. So
yeah, and that makes sense. It makes sense to be concerned about it, and you went in for procedure and you're wanting that to clear everything up. With CAD, there are a couple of risks involved with some things. I know that some behaviors, specifically with smoking, needing exercise, you have alcohol, and then you can have amount of sleep. All of these can end up affecting CAD. And so I want to go through with you on how we can help you have the best outcomes and how we can make the most out of our sessions here.
Wait, are you trying to make me stop doing these things?
It would be best if you stopped doing them, but limiting them and doing them a little bit less and less would make it so that you'll be able to have more benefits and be able to have better outcomes with getting back to work and reducing the risk of CAD.
Okay. We'll hear you out here, sir.
Okay. So, looking at things, I know you've been talking about how you don't want to change your lifestyle. Things may not be exactly where you want them, but at the same time, you don't feel like your habits should be affecting it that much, right?
Mm-hmm.
Okay. And so I feel like we've had where I know one of the big things that can end up increasing the risks of CAD is smoking, and I've heard that from you before that you tried to quit smoking.
Yeah, but 3 packs a day since the 7th grade. It's kind of hard habit to kick,
Mm-hmm. When you tried to stop before, what did you find successful, or what were the main things that stopped you from being able to stop?
I just noticed I got a lot more angry when I was off the cigarettes. So I think I'm a pretty peaceful guy right now, if you know what I mean.
Yeah, you seem to be, pretty reasonable guy here right now.
For now, yeah.
Yeah.
Might need a smoke later, but.
Mm-hmm. Yeah, you use it to try and relax and stuff, right?
Mm-hmm.
Yeah. So, There's other ways that you can end up relaxing yourself or try and stop yourself from smoking. Like you'll end up having where the effects of smoking immediately your body will start to repair the damages as soon as like within hours of you trying to stop smoking. There's actually a Princeton professor where they did a study where they can try to stop smoking for years, and they decided, you know what, it's not for me. I'm just gonna be a smoker. My dad never smoked a day in his life, and he died at 45 with lung cancer. And they tried to quit, and it just never worked for them. And that doesn't have to be you. For them, they did end up quitting. For them, they ended up using CBD care gummies to end up negating, like helping negate the cravings and the like side effects of quitting smoking. So you can end up using those or patches to end up like helping combat those side effects that happen when you quit smoking. So
I don't like candy.
You don't eat candy?
No.
Okay, that's all right. You know, you don't have to try that, but I'm thinking like if you are wanting to make the most of this, we can try and keep going forward, and so you can end up doing exercises like meditation or breathing techniques instead to try.
Is this like a yoga thing?
I mean, there are some that include breathing techniques during yoga, but it's not necessarily limited to yoga. But you can use it to help yourself relax more, and as an alternative, and it doesn't cost you any money.
I like free. I am pretty cheap, so.
So I'm not saying you have to like cut it out completely. That would be the best, but just trying to limit it as much as possible. The longer you go without smoking, the better the more you reduce the risks involved with CAD on your arteries.
Is there any option besides that? I don't think I'm gonna give up smoking. That was a little too hard for me.
You also have like another risk involved is with your drinking. You know, where you've been having a couple beers a night.
Doc,
I mean,
you're just gonna take everything away from me.
I'm not trying to take everything because I don't think that's realistic that you're gonna cut everything out. Like it's just not gonna happen. But if you could try and limit it, where it's like, hey, I'm gonna have a drink with the buddies on the weekend, or with like I'm gonna have a glass of wine with my wife on the at this special dinner. This is our anniversary. I'm not saying you need to cut it out completely, but trying to reduce it so that those risks aren't gonna be as troublesome in the future.
Okay.
So, and then the last thing that's also like in your control and that you're able to really kind of maintain and lower your risks are increasing your exercise. So there's a lot of different kinds of exercise that you can do.
I get enough on the yard though.
Yeah, I know you were saying that you were getting enough on the yard in the past, but you're not able to quite keep up at the yard like you used to, right?
Well, these young bucks, you know, they're taking this steroids and stuff. It's hard to keep up, you know.
But like that's why you're here with me right now, is because you had where you weren't able to go back to work, and so I'm here to try and help you get back to it and to kind of like, how long do you think it would take you to get back to where you were without help?
I mean, ideally immediately, but months maybe, I don't know.
Which, yeah, it might be the case, and like I'm here to try and help you, like give you the exercises, give you the different things, the tools to help you recover faster, so that you're able to get back to work, so you don't have to worry about when of the bills going to start coming due. So my goal is to help you with that as soon as possible. One of the best ways, I know you've been talking about where you're worried about overexerting yourself, that you're gonna hurt yourself because of CAD, and like that it's gonna end up leaving your wife and your kids. A way that we can end up doing exercises safely is you have something called the Borg scale for self-monitoring. So you have it's a 0, like the modified version is a 0 through 10. 0, you're at rest, like you're sitting right now. 0, like no effort. 1 is easy. 2 is like a little harder. 4 is probably about the max I'd want you to do, like where you're feeling a little more difficulty, so like a little moderate. 5 would be like pretty difficult, and I wouldn't recommend getting to that point. For now, I'd want you to keep it pretty easy, pretty light. Like if I was to get up and go on a walk, depending on how quickly I'm walking, I just rate that at like a 2 or a 3. So right now, I'd say take it really easy. Probably go on a walk, keep it at like a 2, maybe a 3 if you're feeling pretty confident. You were saying you were having troubles like at the yard getting up to your office, going up the stairs.
Yeah, so we usually got to lift quite a bit of stuff, even though I'm just kind of conducting. So
Yeah.
that, and then walking around my neighborhood's getting up to maybe off of your scale, maybe even a 5. So
Okay. So I'm wanting you to keep it really easy with like 2, 3, maybe a 4 at the max. But right now I know you're really concerned, so we can work our way up to that point where you're getting it farther and farther. And you know you were saying that you were having trouble. You were wanting to go fishing, and that you have a fishing hole that's nearby your home.
Yeah.
Right? Okay.
well, I'm not gonna tell you where it's at. But
Yeah, that's all right. You know, maybe one day we'll go fishing together.
I don't know, not in my hole.
Well, I'll invite you to come on one of mine.
All right.
So, but that can be our goal right now. Like, I want you to be walking about, 3 days a week. You can do like Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, and you were right now just keeping that easy pace. Walk, say 5-10 minutes towards that, so towards where your fishing hole is. Because right now you're not able to get there. I know that's an activity that you want to continue to do, especially where you have this kind of time off.
Mm-hmm.
And so we can work towards making sure that you're able to participate in that again.
Yeah, but that's where I get most of my smoking and drinking done.
I mean, maybe then you'll come with me to one of my fishing holes, and so then, that's not ingrained, but you can still, you don't have to necessarily walk there. We can have you walk somewhere else, but I just want you to work on that a couple times, like three times a week, on doing some right now some fairly easy walking, but you can kick it up to moderate if you're feeling good about it. So just to try and give you a little bit more aerobic exercise and help with that lung capacity and stuff. And then, as well as I know you're saying that you're having, you're struggling being able to lift weights. Overall, like when we did the overall look, generally your muscle tone is looking pretty good. Your range of motion, your oxygen saturation, your heartbeat, all of that's looking really, really pretty solid. And so it's more you're just getting fatigued more quickly than normal. And so, along with doing the walking, I want you to also do like twice a week, just do some light weights. And right now, you don't have to do anything crazy. Just like, okay, you can do the walk Monday, Wednesday, Friday, and then do like some light weights on Tuesday, Thursdays. So, and then before you do each of those, just make sure you warm up, like do like some stretches or something to end up making sure that you're feeling good and able to do these exercises.
Well, can you provide me with some stuff? Because lifting weights doesn't really, we don't really go together, if you know what I mean.
I mean, so you can keep it really easy. Got a couple of weights over here.
Oh, yeah.
So these are, these are just for look, but so you'd end up deciding, I wouldn't end up recommending going over 10 pounds. You probably do somewhere around 5 to 8 pounds right now. Something pretty easy. And then you just do like 2 reps of 10. And you just, you can end up doing bicep curls for those exercises, or we can end up having you do a couple other exercises if you're wanting some other recommendations. But I wouldn't end up recommending too much weight. So it shouldn't, like those couple reps, they shouldn't take you longer than like 15 minutes. So it'd just be like 30 minutes a week doing that. So it shouldn't be too much.
Okay.
So, and then do you have any other questions about CAT or about the exercises that I'm, like the results or anything?
It said in the pamphlet somewhere, or not in the pamphlet, sorry. You mentioned last visit, love making. Still kind of nervous about that.
Okay.
I mean, it's good, but not worth my life, How do I go about doing that?
So you shouldn't end up having a problem, like with having had the CAD, and you're not going to end up, it shouldn't stress your heart to where you're going to end up having a problem. They've had multiple studies where men or their wives have been worried about causing a heart attack or causing some kind of like issue medically after having had CAD or other heart conditions. And having intimacy with your wife shouldn't be an issue. And especially as you do the exercises, you'll be able to feel better about yourself overall.
Okay.
So, yeah. Do you have any other questions?
That's all I got for you, Doc.
All right. Thank you, Arthur, for meeting with me.
Thank you.